Dr. Edwin Williams here in a takeoff of our fireside chat, trying to give you some answers to questions you might have about how to prepare aesthetically for a wedding. Well, you want to make sure there's sufficient preparation and time to really achieve the maximum results. And there are different options because you have surgical options and non-surgical options, and both of them take different amounts of time, and it depends on who you are. Could be the bride or groom, could be family of the bride or groom, and certainly the bride is the center figure, so they want to be flawless, and so that recovery might be a little different, for example, than someone who is a sister of the bride. Bridal party and guests, and we get these requests on a regular basis. So let's talk about recovery time and post-care. Surgery, you definitely want to make sure you leave enough time, typically 6 weeks to 12 weeks. Depending on the procedure. For example, someone who's having a breast dog, 4 to 6 weeks is not a big deal because no one's really going to see you. Someone's having a rhinoplasty, but really the surgical procedure is going to be at least 3 or 4 weeks, I would recommend. For the bride, I would recommend 2 to 3 months, although I did have one patient stress me out once and we did her rhinoplasty 3 weeks before her wedding. So then there are the non-surgical options, and they're different. You want to make sure there's ample time for the treatment to work. For example, Botox, even though it has very little recovery, the result kind of peaks in 2 weeks. So you want to wait somewhere between 2 to 4 weeks before the wedding to allow the maximum results. And fillers, usually there's an immediate result, but you can have a little bit of bruising that takes a couple of weeks. So you want to make sure that if you're going to have a filler, something in your lips, a little volume or folds, you want to make sure that's a couple weeks before. Skin improvement, 1 to 2 months typically for the topical things like retin-A, peptide, stem cells, and growth factors. You really want to have enough time, 1 to 2 months for them to work, to see results. Other skin treatments, things like TCA chemical peels, microneedling, radiofrequency, they're often done 4 weeks apart. And we recommend if you really want to try to see the best result, you probably need to leave at least 6 to 9 months. You can still see a result as little as 3. So what are the costs and treatment? Typically Botox is about $15 per unit. Plan on 20 to 35 units for example, the glabellar area, which is the FDA approved area. People get it in a lot of different ranges. Filler is somewhere between $400 and $1,600 depending on the type of filler and where you're having it. Microneedling, typically 4 weeks apart. It's about $300 for the face. Typically a package will work somewhere around $1,000. And a TCA chemical peel, the lighter peel, somewhere between $300 and $900 depending on the strength of the peel. Radiofrequency, which is the collagen tightening type of procedure, anywhere between $595 and $2,000 for a package of 4, and they're typically spaced 4 weeks apart with very little downtime with this treatment. So I hope that answers your questions on how to prepare aesthetically for a wedding. There's much more information and details on non-surgical and my surgical facial plastic procedures. Basically any question you might want on facelift and rhinoplasty, check out my YouTube Cosmetic Surgery Vault at YouTube/Williams Center, and follow me on Instagram at Dr. Ed Williams. Thanks so much for watching our video.